Question 106, Srimati D. Purandeswari.
Thank you, sir. Question 106.
Honorable Minister of Health. Yes.
So question 106, A to C, a statement is laid on the table of the House.
Yes.
Sir, as on date, the total spending on healthcare is a meager 0.9% of our GDP. And the Common Minimum Program has promised to enhance this expenditure to about 2 to 3%. In view of the chronic disease epidemic that India is likely to face, I would request to know from the Honourable Minister the steps taken to raise the required funds to meet the staggering expenditure that is required to meet this challenge, sir.
The Honourable Member has rightly informed that the health spending today is below 1%, sir. And the UPA government, under our Honourable Prime Minister, has promised that we will increase the spending of health, public health, from today 0.9 to minimum 2 to 3% in the next 4 years. And rightly, sir, in fact, in the health budget, we had literally 32% increase over the last year in the health budget, and we are implementing the National Rural Health Mission, which has been inaugurated earlier this year in April. We've been implemented in 18 states, and we are going towards achieving a goal of minimum 2 to 3%, sir. And especially coming back to chronic diseases. Yes, sir, the WHO has informed us, in fact warned us, that coming today's infectious diseases or communicable disease, tomorrow there's going to be a major problem of non-communicable or chronic diseases like diabetes, cardiovascular, stroke, cancers, mental health illnesses. So we are trying to have new programs on those issues, and sir, my Prime Minister has promised that a lot of full priority will be given the health sector, and more investment in the public health sector will be envisaged.
Second supplementary.
Sir, the Honourable Minister himself on one occasion has admitted that India is the diabetes capital for the world. And reaffirming this, WHO has already confirmed that by 2015, the diabetes-related deaths are going to be around 35%, sir. And similarly, sir, the heart disease prevalence is going to rise by about 8 to 10%. Then the stroke-related diseases are going to be around 203 for every 10,000 population, and every year there is going to be fresh cases of cancers. Around 8 lakh estimated cases are supposed to be repeated every year. So, in view of this grim scenario, there is every necessity for us to introduce the geriatric department in our government hospitals and also include geriatric medicine in our MBBS curriculum. And this was also recommended by MCI even as way back as September 2000. So I would seek to know from the Honourable Minister the concrete steps taken in this direction, sir. Thank you.
So the Honourable Member is right in these figures of increasing the chronic diseases, especially cardiovascular, diabetes, strokes, mental health illnesses and cancers. And these comprise not only for the geriatric patients or the senior citizens, but also the youngsters. We have juvenile diabetes for the school-going children also, especially that, even the adults also. So we are trying to work out a comprehensive program, an integrated program on diabetes, cardiovascular and stroke. This is going to be a new program, sir, and we have got the in-principle approval of the Planning Commission. And this program, we are going to plan out on a larger scale of prevention, creating awareness, surveillance, screening, management of the disease and doing research. So all these components are going to be part of this integrated program on diabetes, cardiovascular and stroke, where we are going to reach out the school children as well as the senior citizens also, sir. Coming back to the question about the geriatrics and senior citizens. Yes, sir, today the life expectancy in the country is 63 years old, 63 years, sir. And in 15 to 20 years, we expect it to be about 75. So we are going to have a lot more senior citizens in the elder people in the country, and we have to take care of them. So we have to change our policies and priorities in the health sector, which we are trying to do to take care of them. And in fact, we are trying to start 2 new institutes of aged or geriatrics, one in north and one in south to start with, to implement more policies and for training of these doctors and nurses on specialty of geriatrics. And we have ordered that all the central government hospitals, including the CGHS dispensaries, must compulsorily have a separate queue for OPD for senior citizens. And in fact, we are trying to have a separate ward or separate building in AIMS for geriatrics for senior citizens in JIPMA and PGH Chandigarh to start with. And we are trying to do our best in this.
And old men have some hopes, okay? Ingrid MacLeod. Ms. Ingrid MacLeod.
Thank you, sir.